My name is Jessica Schmid, and I'll be doing my case study on a client that I've been working with for several months now. This client is 12 years old and was diagnosed with autism spectrum disorder. I know that it's important to review records and available data at the outset of a case. I was not a part of this process since this individual has been a part of our program for several years now, but I was able to speak to the BCBA over this individual and get a very good understanding of this process. Part of the process was looking into the medical history. This individual has hearing loss, and that causes them to have to wear a hearing aid. This is pretty important for us to know as it does affect our everyday sessions. It determines how loud we need to speak, and when we are doing our programming to recognize when they did not hear the SD and when they are not responding to the SD on purpose. They also suffer from lung disease that was diagnosed at birth, and that resulted in a heart transplant in 2016. They have a suppressed immune system, which was pretty important for us to know as well, since parents have requested that we do not come to sessions even if we are just a little bit sick, because it really puts this person at risk, and we don't want that. We want to keep them safe. They were diagnosed with cancer and went through chemotherapy in 2020 and are now in remission as of March of 2021, which is good. They had a heart block requiring a pacemaker before the heart transplant and suffer from atrial septal defect. Family history. Parents do not know of any history of autism, developmental disabilities, or mental illness. When it came to education and service history, we know that in 2017 they were enrolled in 3 different programs. In 2019, they attended an autism support program within a university. And as of right now, they are attending 4th grade, where they have a full-time aide and receive speech, occupational therapy, and physical therapy. When it came to cultural considerations, there were none to be considered at this time. I know that it's important to determine the need for behavior analytics services. The reason the services were requested in the first place were initially because of the diagnosis of autism. However, parents really wanted to expand food interests as well and improve bedtime routines and communication skills. That was at the beginning of the services. However, they want to continue services because they still want to address communication and social skills, self-management skills, and independent living skills. Behaviors of concerns that we have observed are aggression and task refusal. The assessments that my BCBA decided to use were AFLS, the Assessment of Functional Living Skills, because parents requested independent living skills to be worked on. And as we know in the Ethics Code 2.09, that we should be including clients and stakeholders. So if it's important to them and it's going to improve their lives and the clients' lives, then it should also be important to us. In this assessment, it also has self-management strategies, and it touches on problem behavior, which seemed very applicable for this particular individual. For PEAK, Promoting Emergence of Advanced Knowledge, she decided to use this one to help this individual learn emergent skills like generalization, and it directly assessed things, and the BCBA felt that it would be particularly helpful for this individual. Then the FAST functional assessment screening tools also used to help determine the function of aggression and task refusal. The results showed us that for AFLS, that in this past year, 2023, that improvements have been made in tolerating haircuts and dentist visits, social communication, including answering and reciprocating social questions and staying on topic, and the individual had become more independent with daily living skills such as brushing and flossing teeth, taking a bath, dressing, and brushing hair, which is super awesome to hear. This assessment also showed us that this individual still needs to improve in daily living skills such as tolerating independent time, tying shoes, washing face, and packing a bag. This was really cool because I was able to work with this individual on things like hair cutting and reciprocating social questions. So it's really cool that those were effective and caregivers are seeing improvements in these things. And it was very helpful to know where we should go next. And since this had been conducted, we have implemented programming for independent time, tying shoes, washing face, and packing a bag. So I feel like we were able to identify and prioritize socially significant behavior change goals based off these assessments and the caregiver's requests. For the peak, this individual displayed improvements in direct training and generalization models. They scored within age norms for verbal comprehension and basic social skills. And although they displayed improvements with those things, they still scored below neurotypical peers in most areas of the peak assessment. So the BCBA decided to focus on the skills that they scored the lowest on. Those included foundational learning, verbal reasoning and comprehension, memory, advanced social skills, and problem solving. This was really cool because I was able to help with some of the programming that improved with his verbal comprehension and basic social skills. And since this assessment was conducted, we have already implemented programs for memory and problem solving. So it's cool that those assessment results were able to guide us where we needed to go next. As far as the FAST went, the results suggested that aggression was possibly maintained by access and escape. This makes a lot of sense to me as I look back on my own experiences with this individual and find that aggression is typically seen in my sessions at the beginning when they are prompted to put away their iPad and begin ABA sessions and they don't want to. And with access, I've seen this individual engage in aggression towards siblings when they want an item activity that the sibling is withholding. For task refusal, it suggested that it was possibly maintained by attention, access, and escape. This one was quite interesting since I assumed that it would be escape. However, as I thought more about it, I did realize that when my individual starts engaging in task refusal, oftentimes they go to parents and parents will kind of turn it into a game. And it seems that this parent's attention is highly reinforcing. So it makes sense that it could possibly be maintained by attention as well. And that's all. Thank you so much.